Okay, good. Thank you so much. Good afternoon. Welcome. Thank you so much for investing your Wednesday afternoon with us today. And I hope you will get some valuable takeaways. My name is Robin, and I'm here with my colleague Deb Duda, and we'll both speak today and to talk about how our company, SOC Telemed, has transformed in the past 3 years in partnership with Tableau, and share our best practices and lessons learned with you. So breeze through. Today, SOC is one of the largest telemedicine solution provider. What is telemedicine? Telemedicine is a practice of medicine delivered remotely through a telemachine, which you all have, like phone or video, it's 2018. And then we deliver it remotely where a patient is located in one place and a healthcare provider is located in some other place in different state. We work with 500 hospitals in 36 states and provide full-service telemedicine. You can use any combination of our services, and you can combine our solution in software, hardware, specialist doctors, workflow, licensing and credentialing physicians, and call center. We are Joint Commission accredited for the past 12 years and have 200 board-certified physicians in the field of neurology, psychiatry, critical care, ICU. Beyond those 3 clinical service lines, some of our clients leverage our platform for hospitalists and pediatricians as well. I strongly believe that SOC is transforming healthcare by 1, expanding access of care, 2, bring efficiency by saving time from commute for both patients and physicians, and fractionalizing physician resources because their time is very valuable. And 3, improve outcomes so that patients will have a better quality of life after having an incident like stroke. How do we do that? By working with our partner hospitals and health organizations to bring highest quality care through a technology-enabled platform. But in 2015, when I joined the company, SOC was a very different place. Client satisfaction was poor. We had not invested in technology or tools. We didn't have a data warehouse, and we're doing everything in Excel. Departments were siloed and didn't know what everyone else did. I don't know if this sounds familiar to any of you guys. And then we had a new management team who came in and had a vision that data could solve a lot of these problems. When I interviewed for my job, my role was supposed to stand up a traditional finance function in financial planning and analysis. Soon after I joined the company, my boss told me to purchase Tableau license, hire people, and deliver reports through online. Apparently, our CEO has promised to a very important client that we would do that by November, and it was July. My first reaction was, what is Tableau? And this is how my journey with Tableau began. A small team of 3 very bright individuals, including Deb Duda here and Matt right there. Feel free to talk to him afterwards. They spent a lot of quality time together, let's put it that way, and we were able to deliver our first teleneurology dashboard in time, and everyone was surprised, including myself and the CEO. So when we first started using Tableau, we didn't exactly have a plan, and this was our old Excel-based report, and then we had one analyst doing manually producing this. It was like 117 worksheets, and we just couldn't deliver this to all our clients. So when we started working with Tableau, it wasn't exactly planned, or it was rather very reactive, but soon after we figured out our strategy and objective in data analytics. So our goal is to drive actions that transform healthcare industry. How do we do that? By improving clinical outcomes and operational efficiency through fast, transparent, accurate, actionable data. Tableau Server was our choice of a business intelligence tool, and it serves as the single point of data source and truth. Our users are diverse beyond internal SOC employees. across multiple departments. Our partner hospital executives, clinicians, physicians also access Tableau Server to find their data. We'll share how we manage all that a little later. When I say drive actions and results, what does that look like exactly? For operational improvements, we first focused on SLA adherence, service level agreement that we promised our clients. And it is measured by response time to video. How long did it take for SOC to provide a doctor on video with patient within 30 minutes for emergency neurology? And it also directly impacts clinical improvements because every minute counts for emergent patients like who's having a stroke. And we could really make a difference in patients' life after recovering from things like stroke. During a stroke, brain loses about 2 million cells. Every minute blood flow is not there. So if we are able to provide a neurologist 1 minute faster, that's saving 2 million cells in your brain. And it could affect a patient's life when they, in their daily activities, like speaking, eating, walking, and they could have a different quality of life after recovering from stroke. So other clinical metrics are door-to-needle, case mix, discharge rate for psychiatric patients, and we'll talk about some of these later in live dashboards. And then we wanted to improve client satisfaction and retention. Analytics was an engine for our growth, which also transformed SOC into a culture of data and transparency. With our strategy and objectives, we needed a very strong foundation of modern BI. And this time, I would like to hand over to Devduta, and he will explain how we architect and set up Tableau Server and manage user security.
Thank you, Robin. Can you hear me okay? All right. So thank you everyone for coming out today. My name is Devduta Bhosle. In 2015, SOC Telemed wanted to give our customers access to business intelligence portal. And there are various approaches to enabling external user access to your BI portal. You can do things such as install a separate Tableau server, or you can do custom web portal and integrate using trusted authentication. For SOC Telemed, we had two primary goals. Number one, security of patient information, and number two, we are a startup, we have limited resources, so any solution that we come up with had to be very easy to maintain, scale to thousands of users, and require very minimal additional resources. So in the next few slides, I'll cover how our BI portal architecture look like and cover things such as size, projects, and row-level security. In this slide, in the top green rectangle, you can see how our business intelligence stack looked like in 2015. Like many of you, we love working with data, and so much so that we had more than 600,000 Excel files in our shared drive. And our report distribution tool was Microsoft Outlook. In the bottom blue rectangle, you can see our current BI portal. And this portal has enabled SOC to deliver sensitive patient information to different stakeholders, such as all of our internal employees, all of our external customers, as well as physicians. So let's dive in and look at how we iterated and set up our BI portal. This is our iteration 1. And due to our priority number 1, security of patient information, we decided to use a feature called as sites. Now, how many of you are familiar with the concept of sites in Tableau? Please raise your hand. All right, so great thing with sites is that each site's content is completely segregated from content on other site. And since we are so concerned about patient data security, we decided to use this feature. So we created two sites, one internal site and one external site. And within internal site, we created separate projects for each department. Each department got their public project and private project. And we also started publishing reports to our external site. And fortunately, our analyst team, Matt, Sangamitra here, they did a fantastic job, and we created some great visualizations, and everyone inside the company started to request access to these dashboards. But doing so in an external site would have meant that we replicate all the users, all their groups, permissions, and this really defeats the purpose of having two separate sites. So we started duplicating content from external site into our internal site. And with growing inventory of reports, this also started becoming challenging. Our assumptions were not right. It was time for iteration 2. So we brought all of our external users into the internal site, and to do this, we really had to streamline our access to row-level data security. Every workbook that's accessible to external clients is secured with row-level data security. But we didn't want to do separate row-level data security for external users and internal users. So our approach uses a combination of user group membership as well as information that's present on every single record. And we look at user group membership to decide access, whether an internal user is authorized to see that record. And we look at the list of authorized users for every single record to decide access for external users. We created custom user security tables which could be joined with different fact tables depending on the use case. So our security structure were independent of the fact tables. And all of this information was then combined in a single dimension and exposed in a data source. For analysts, this means that adding row-level security is as simple as adding a single data source filter. One of the other thing is, one of the other goal of any BI deployment as well as a challenge is user adoption. To increase user adoption, you need to do marketing. And a little less advertised feature in Tableau Server is its ability to do email marketing, which is also called as subscriptions. And the reason why I use the term email marketing is, at least so far, the emails that you receive from Tableau Server do not contain either PDF or Excel. It's an image with a link to the Tableau portal, and this encourages people to log into the portal and hopefully explore some more visualization. But the great thing with subscription is that it works in conjunction with your row-level security. So we use this feature extensively to send report and dashboard summaries to all of our customers, and each delivery is customized for that specific client. So to summarize, here are some key takeaways. Default project permissions are great. They really help simplify the administrative overhead, and especially when you combine them with group level permissions. Another thing people don't talk about with BI deployment is it can benefit greatly from applying the same principles the software industry has been using for decades. Things such as code reuse, modularity, and iteration. And the last thing that I want to talk about is that automation and manual processes. Things that we have automated are all aspects of user addition, group additions, setting, assigning users to groups, and as well as row-level security. The things we do mostly manually is the content review. Any content that's accessible to external users goes through a manual process. This helps us ensure that the content meets the performance security requirements. Many times, people complained about slow dashboards, and the root cause lies in the workbook. Because of this manual process, helps us ensure that all of those requirements are addressed. So that wraps up our discussion of the system setup. Back to you, Robin.
Thank you, Devduta. So now let's dive into real dashboards and use cases, shall we? So this one is part of our teleneurology dashboard. So one of our partner hospital was losing their neurology coverage because they used to have 8 neurologists, which dwindled down to 3, and then they all resigned together. And they turned to SOC, and to keep their stroke program alive as a primary stroke center and meet Joint Commission standard. This dashboard is focusing on door-to-needle metric, and which is measured from the door time when the patient arrived to emergency department to the needle time, which is when the drug is administered to the patient. And we are showing it, so And we are trying to meet American Heart and Stroke guideline of 60 minutes. 60 minutes is actually pretty challenging time frame for emergency department to meet, because emergency department is not the most organized or setting. So the ED staff will need to identify quickly that there is a potential stroke, and then send the patient to CT, take the CT, get the CT scan result, and bring neurologists down from floor to ED, read the CT scan, evaluate, and decide to treat with TPA. And TPA is the name of a drug called alteplase, which dissolves the blood clots. And then they have to work with the pharmacy to mix the drug and then finally administer to the patient. So what we did in this dashboard is that we broke down that whole process into 3 buckets. Patient arrival to ED, to initiating consult with SOC, and from there to how long did it take for SOC physician to make a decision to give TPA, and from there how long did it take hospital to coordinate with the pharmacy and deliver the drug to the patient. So those are the 3 buckets, these 3. And then if you combine the 3 buckets, then you get the overall door to needle. That's the idea. And the reason why we broke down the 1 metric into 3 buckets is so that it is evident and transparent for hospital to figure out where they need to focus to improve their overall metric. So if they are taking longer to find out potential stroke and calling SOC, then maybe they can have a better stroke alert system. Or if they are taking 40 minutes to work with a pharmacy, maybe they can work with pharmacy better. So, and on the right side, we plotted every single TPA cases in a scatter plot. So every dot here is a stroke cases, TPA case. And we are just plotting against for those 3 metrics. And the y-axis is overall door to needle, and the x-axis is those 3 metrics. So when the slope is higher, it just means that maybe you want to focus on that workflow to improve your overall door to needle, because higher slope means higher impact. And everyone suffers from limited resource, especially hospitals. So we want to be smart and focus on an area that has bigger bang for the buck. So for this hospital, their average door to needle improved from 57 minutes to 32 minutes, which decreased length of stay and improved patient outcome. The next one is benchmarking dashboard, where we allow our client hospital to compare their metric against peer group. In this view, we are comparing door to needle again in those 3 buckets. And the client in this case is a corporate hospital system with multiple hospitals, and each circle is a hospital. The dotted line is peer average. These 3 charts are comparing where the hospitals are lying. So if I am the client, I would focus on this gray hospital that are above, so worse than average in all 3 metrics. Maybe I want to talk to the hospital and see what's going on. And so for this example hospital, another primary stroke center hospital was in jeopardy of losing their stroke certification because only 30% of their TPA cases were under 60-minute mark. And they need to be at least have 60% to keep the certification. So within a year, the hospital worked really hard, revising workflows, training staffs, and they exceeded their goal and had 80% cases under 60 minutes. The stroke coordinator said that our reports are easy to use and user-friendly, that really helped her in her constant communication and collaboration with her ED team. The next one is a physician dashboard that SOC internally uses. By the way, Dr. McDreamy is not our actual staff, just to be full disclosure. It shows that the trend of case volume, productivity, and some clinical metrics. Before this, SOC physicians had been working in silo for a long time and didn't know their good or bad performance. And they also didn't know which metric had bigger impact to patient care. Now, physicians proactively discuss ways to improve performance and patient care. As a byproduct, physician productivity improved more than 200%, which is remarkable. This is our teleneurology dashboard that our clients receive every month in their portal, so they can log in and view this anytime. Only 20% of our clients received a monthly report in Excel format before we adopted Tableau. So now we have 100% of our clients receiving their monthly report. Therefore, overall client satisfaction improved dramatically, evidenced by Net Promoter Score increasing by 50 points. It used to be negative, therefore 50 points. And next, let's talk about how all these improvements translated into bottom line profit. One of the most challenging part of our business is balancing supply with demand. Supply meaning our physician resource, and demand meaning consult requests from hospitals. We are basically trying to predict when patient would walk in or taken to emergency department with a symptom of stroke or psychiatric episodes, things like that. So in short, optimizing demand and supply drove a massive growth in profit and also physician productivity. The important thing is that we were able to double our profit margin while improving quality at the same time, and that's not an easy thing to do. Next, I want to show you guys a picture of our office. This is our consult coordinator center, essentially a virtual hospital where we are connecting patients with doctors. In our headquarters in Reston, Virginia, we have these large TVs all over the place. This one is showing rolling 14 days time to video, and then this one is showing past 24-hour patients that we've seen. So these are live in real time. And so the culture of data is truly driven by top management, I believe, and we are fortunate to have very data-driven management team who makes decisions based on intelligence, not feelings. Again, this is inside of our consult coordinator center, and our employees can view the dashboards on the screen and make real-time decisions. These maps are showing our supply by state, because our physicians need state license per each state. So even if they are on schedule, if they don't have license to a certain state, they can't see the patient. So this is showing that supply. In the interest of time, I'll breeze through some of the next few slides and get to the lessons learned. So this is lives touched in the past 24 hours. So each dot, the orange dot is the active consults that is going on at the time I took a snapshot, and the blue dots are completed consults in the past 24 hours. So you can see that we are touching lives everywhere, or at least in 36 states, and knowing that each dot is a patient and somebody, and that we are touching somebody's life really makes difference, and it's a motivating factor for all employees. So benchmarking dashboard, we are using HexMap. So lessons learned and tips. So first lesson is that users are always right. There is no such a thing as a user error. Let's say I got a new bag, and I can't figure out how to open it. And I'm told that it's a user error, and I have to follow these 3 exact steps and to open it up. And I mean, seriously, it should be intuitive and frankly mindless. So dashboard also I should not require too much brain power to digest. And if it does, no one will use it. People have better things to do with life. Therefore, please design the dashboard to empower users to immediately visualize the next action steps to make an impact. The second point goes with the first one. In order for your dashboard to be successful and engage users, they need to feel like they own the data, and the dashboard is showing whatever they want with slicing and dicing data. As an example, we find action filters or user-defined benchmarking those were helpful in engaging users. And third, cultural data doesn't come naturally or automatically or even organically. You have to be intentional about building such culture. And for our case, top-down approach worked effectively. To share some specific strategies, like I mentioned earlier, we display data everywhere in our office and talk about it. Our COO is literally obsessed with sequential improvement. It doesn't matter to him if we hit a historic high last month and therefore this month is slightly down. To him, we didn't improve this month. Yes. So his logic is that if you get an A+, you can get it again. But we don't just beat ourselves all the time, and we do celebrate successes and share with our clients and employees because we are all in it together to transform healthcare. What I really would like to share is that Tableau is a great and easy tool to make things happen in a relatively short period of time. From nothing to robust business intelligence tool and highly engaged users, modern BI, cultural data, transforming healthcare. And seriously, many of you guys work in healthcare, or practically everyone is a patient or family of a patient at some point in our lives, right? We are in the business of transforming healthcare together. I don't know about how you feel about your experience with healthcare, but I think healthcare industry needs help. And we can do that with data. Data should speak for actions. I would like to strongly encourage you to display data in a way that naturally bring out certain actions that make positive change. This is how we transform healthcare together for our own future and for the next generation. Thank you. That's all I have, and we'll stick around for a bit for any questions. And we have a lot of analysts and team here too, so you can talk to. Again, I really appreciate your presence here with us today, and please enjoy the rest of conference. See you around. Thank you.